Hi, I'm Anna, and I'm going to be going over an analysis of the Vaccines for Children program. Just to start off, what is this program? The VFC is a federally funded entitlement program through the CDC that seeks to widen access to the vaccines included in the list published by the Advisory Committee on Immunization Practices for children who may have not otherwise been vaccinated due to financial barriers. Those who are eligible have to fit into one of the following categories: Medicaid eligible, a CHIP enrollee within a Medicaid expansion program, uninsured, of American Indian or Alaska Native descent, or underinsured. It is really important to know the difference between uninsured and underinsured. To be underinsured means that the child receives private health insurance, but the plan doesn't include the vaccines covered through the VCF, or the plan sets the maximum amount that can be spent on vaccines. I found an article titled, "Since the start of the Vaccines for Children program, uptake has increased and the most disparities have decreased," which was published through Health Affairs in 2016. For this article, researchers were specifically studying the relationship between income disparities and vaccination uptake between and among races from the founding of the VCF to 2013. The researchers used data from the National Immunization Survey, which looked specifically at children 19 to 35 months old. They gathered information through random digit dialing phone surveys and mailing paper surveys to the 44,000 program providers throughout the U.S. and the 5 territories. They also made a few alterations to the data. First, they merged separate years into 6 time periods, which increased the sample size and limited the impact 1 year can make on the entire study. Secondly, they equalized household income, which means that the number of individuals in the household is taken into account. Overall, they completed 3 analyses. First was an unadjusted vaccination rate, which involved tallying all vaccinations given out and distributing them to the appropriate race or ethnicity. Secondly, they calculated an adjusted vaccination rate through multivariate probit analysis. And finally, they created concentration indices that gave estimates of disparities in vaccination uptake by quantifying the differences in the amount of health care. For the unadjusted vaccination rates, they saw that there had been an increase in vaccinations since the VFC was founded, but this wasn't constant across all the time periods. Also, the disparities between racial groups decreased over time, and the largest increase in vaccination rate was seen among low-income Hispanic children. Looking specifically at the last period, it was evident that higher-income children had higher vaccination rates regardless of race. Moving to the adjusted vaccination rates, the researchers controlled for a variety of characteristics, including age and education of the mother, marital status of the parents, the child's sex and state of residence, whether the child was the firstborn in their family, as well as a multitude of others. It was observed there was a considerable change in the likelihood of vaccination over all the period studies, and the largest initial disparity came between high-income whites and low-income Hispanics. Finally, coming to the concentration indices, it is first important to understand what the estimates mean. Here, +1 means that there is a pro-rich disparity, or only the richest families are vaccinated. -1 means that there is a pro-poor disparity, or only the poorest families are vaccinated, so 0 would mean that there's no difference. It was observed that the largest disparity came in 1995 to the 1997 period, particularly favoring richer families, and the largest reduction in these disparities came between that same period and the 2011 to 2013 period. It is also important to note that there are large differences between income and racial groups, especially favoring white children, but these decrease as the VFC continued to exist. So in conclusion, there is evidence that vaccination rates increased while the VFC was functioning, but additional studies are needed to evaluate the effectiveness of the program. There were just too many uncontrolled factors that could have influenced the vaccination rates, like the passage of the Affordable Care Act, more news coverage on the possibility that there is a link between the MMR and developing autism, and even changes made to states' lists of approved exemptions. So while the point of the VCF was to increase vaccination rates across the board, we need to have more studies that will grow our understanding of why those that stand to gain the most from eliminating these financial barriers still remain unvaccinated. Thanks.